Well, my name is José NUÑEZ. I'm from Spain. I've been a transplant surgeon for 32 years. And during this step in my life, I saw uh, people from both sides. I saw people recovering life, recovering normal health after a transplant. But I seen also the other face, and the other face is people suffering and people dying because they were waiting in the waiting list period. So after this long clinical practice, I have the good option 3 years ago. WHO offered me to join the organization and try to work in this medical products initiative. And medical products is not only organs, it's something else. It's blood, it's blood derivatives, it's stem cells, it's tissues, breast milk, is include very many things. Anything coming from a human being and goes to another human being. So I thought 3 years ago there was a good option to come to live the first line of clinical practice and come to WHO, trying to collaborate and lead this medical products team. Because medical products have different tasks, different and important tasks. Probably one of those is the shortage of supply. And shortage of supply is very much related in some part of the world with something like the expectancy of life. People have a longer expectancy of life and they want to live longer, and they could live longer, but they want to live in good condition, and this is where the medical products makes the difference. But unfortunately, in other parts of the world, this long expectancy is not the same, and it's also related with health services, but sometimes related with medical products, as they don't have access to a simple product like blood. But it's not only the main task, is not only this shortage of the supply, the shortage of or the increase in demand, but also the inequity in the access. Inequity in the access to different people in different areas of the world. How can we work on this? How can WHO address this main task? First, about shortage of organs, shortage of medical products. How can we work on that? The first way to address this shortage is trying to decrease the demand. To decrease the demand, working across the organization with different departments for prevention the use of these medical products. Prevention through working with diabetes, hypertension, obesity, hepatitis C, all those pathologies, all those illnesses that finally goes to the need of an organ, or a tissue, or any products. But it's not only prevention, it's something else. We have to ensure that these products are only used when no other treatment is possible. And to decrease this demand, we have to be able as well that when all these things does not work, and finally in this last step of the chain an organ should be needed, we should be ready to develop and implement donation programs around the world. Donation programs based on voluntary donation, both from deceased and living donors. Because we shouldn't forget that under this medical product is another concept. It's the concept of humanity. Humanity, because we should be able to receive and also able to give. We should be able to obtain a product from another human being to save or to improve our life, but we should be able and be ready to give this product to others to save their life or improve their life. And how can we work with the second big task that we're talking about the equity in the allocation, equity in the access to this product. Well, the only way is to promote a common framework, a common network, a common governance mechanism, and common tools that ensure that this product can move from one place to the other and access to all people. But this promotion should be based on ethical practice that are very much included in the guiding principles, in WHO guiding principles on blood derivatives, organ, tissue, and cells. And in summary, these guiding principles, what their base is: first, informed, free consent in the donation, and second, equity and safety in the allocation to all people. But at the same time, we have to ensure that a common global governance mechanism to ensure that unethical practices are prevented. In this sense, WHO has a great commitment with the Council of Europe Convention Against Organ Trafficking, because for the first time give us a common tool to build a global governance mechanism, a global regulation, so that can prevent that any unethical practice performed in any countries could be prosecuted. I'm sure that working together across the organization with health authorities around the world and with the stakeholders, I'm sure that we will win this battle.